Today is December 9th, 2009, and the question on a lot of internet websites now is the public option dead? Apparently, last night, Senator Harry Reid of Nevada was trying to concoct a deal with centrist Democrats and those evil Republicans to try to get some type of agreement on health care reform. And of course, everyone knows is that there are certain, not only all Republican senators reject the public option, but the key centrist independent, I guess he is, Lieberman, absolutely refuses to vote for anything that contains a public option. And his former party is very upset about him because of that, because they feel he's the one that can prevent health care reform, especially if the Democrats can't win over Olympia Snowe. But anyway, the new plan that they're working on, I guess, is instead of a government-run public option, it's going to be a private insurance option that is regulated by the same organization that regulates federal health insurance benefits. The congressmen get to choose all their good health insurance, and they can look around and stuff. And this one body, whose name escapes me, regulates it. And now they want that same body to regulate a non-for-profit health insurance option in place of the public option. And so the question now is the public option dead? And the answer, of course, is no. Okay, I rarely will put out a video based on every little development, but this one I thought was specifically intriguing. Not only because it's the first attempt the Democrats are trying to drop the public option to get this healthcare reform thing passed, so Obama doesn't have egg all over his face. But I'm more interested in what the Republicans are expected to give in to make this work. I used to be a Republican. I'm not anymore because I don't like the Republicans anymore. I think both parties are willing to shirk their principles at the first sign of an election, or at the first sign of their policies not immediately working, to keep their seats. So I don't like the Republicans. But I think it's very interesting that, like I said, this plan would not have a government-run public option. It would have a non-for-profit private insurer providing cheaper insurance, apparently, that is regulated by the government. However, the most interesting thing is that to get this to work, the Republicans had to concede something on Medicare, and apparently no one is talking about this Medicare concession, which I think is the most dangerous thing about this deal. And that, of course, is that now they want people as young as 55 to 64 to have to purchase their insurance through Medicare. Everyone knows that Medicare doesn't start until age 65 in the United States, and everyone knows that Medicare is a single-payer system for elderly people, one of those grand society reforms as LBJs that's been bankrupting our nation for decades and has cost fucking 4 times what it was supposed to. But now they want to essentially lower the Medicare age. Okay, and this is seen as a concession. I'd say there was actually an article about 4 months ago by Howard Dean, no less, who said the Democrats needed to do something like this because they needed some immediate results in the healthcare debate to keep their seat. So that's the great Howard Dean, who just worries about the Democrats, staying in Congress, as if the Democrats gave a shit about any of their constituents any more than the Republicans generally do. But this is the really dangerous thing, and I think it's hysterical. I posted another video that my grandfather was in the hospital this year. He's recovered, thank God, but was in the hospital for about 21 days. And he's 84, so he was on Medicare, of course. And 21 days in the hospital cost $205,000. Now, when I first saw that bill, I was thinking to myself, and I was kind of like, I wonder if my grandfather, who would have been about 45 when Medicare was first passed, I wonder if my grandfather paid anywhere near $205,000 into Medicare. And I went and asked my father that. I said, hey, Dad, did Grandpa ever pay $200,000 into Medicare? He's like, no, he didn't. What the fuck are you talking about? Are you kidding me? Of course he didn't. I don't know how much my grandfather paid in. It was certainly nowhere close to $200,000. So this is the part of this plan that I see is very dangerous. Whether or not the public option is dead, this reform is bad, okay? Because whether people are willing to admit it or not, a system like Medicare essentially encourages people. People will argue that single payer encourages people to go in early so that their diseases or their ailments don't get worse and then get very expensive. It's actually quite opposite. In every single payer system, and you see this in the massive wait times in Canada and in England, everyone goes in for every little thing. Okay, it's the equivalent of going to a buffet style restaurant. Once you pay the $15, you're going to go and have 6 plates of food. Otherwise, you wouldn't be going there. Okay, and the option is to go and eat as much of the food as you can, because that's the point of paying the cover charge. Okay, so the problem with this is that people age 55 and younger are going to go up and start draining Medicare even faster than it's being drained now. And I know everyone will say, or some people will say at least, well, you know, not everyone who pays into Medicare will use it. Very true. Some people die before they ever get to draw the fund. Um, but people will argue that there's some people who are reasonably healthy whose money then can go to the sicker people. Well, here's my question for you. Can you name one elderly person in your life that has never drained hundreds of thousands of dollars from Medicare? All four of my grandparents have spent active time in the hospital. Two of them have passed away, but all four of them had spent active time in the hospital in their lives, and only one of them had a chronic smoking habit that contributed to her ailments. The other ones, it was essentially based on very minimal lifestyle things like being overweight and basically genetic-based stuff. This idea that old people don't really, some old people don't draw funds from Medicare. Are you fucking kidding me? Do you know an old person that doesn't go in once in their life for a heart-related problem, for a breathing-related problem, for a hip replacement surgery, knee replacement surgery, some type of heavy medication that they need, wheelchair, some type of special thing to get around in their house. My one grandmother has to use one of those electronic chairs to take her up and down the stairs, and that was very expensive, I'm sure. And so my point is that this is a dangerous part of the plea. Is the public option dead? No, probably not, because from what I hear, that number one, I don't expect the progressive / socialist Bernie Sanders and people like that to accept this. And it's almost certainly going to contain that stupid trigger option, which means, and all we're doing right now essentially is bifurcating the stepping stone to single-payer healthcare. We're cutting it in half. We're going to have a private public option, and then we're going to probably, when this fails, I'm sure we'll have the public option a few years down the road, and then we'll have single-payer healthcare, and I predict we'll have single-payer healthcare within the next 15 years in the United States. But this is the really dangerous thing, this Medicare agreement, because again, the system is already going bankrupt, and I'd say that these people who support single-payer healthcare, of course, when I tell them, name one government-run entity that isn't hemorrhaging money or isn't using more money than the government ever anticipated, and of course they can't answer that, but Medicare is one of those systems that's using much more money than we ever anticipated, and this is only going to further its demise because we don't have the money to keep paying for every medical ailment of elderly people. And I'd say, and I just asked this question: did Medicare, that government-run insurance, that help lower the price of healthcare? No, because when they reimburse at 65% of surgeries, hospitals are forced to raise the price of surgeries for people with private insurance to make the money back, and that's what people don't understand because they've never taken economics in their lives. But anyway, so is the public option dead? No, not really. If anything, this is just going to delay it. But I think it's hysterical that Joe Lieberman has actually managed to spite his former party a little bit. But I think it's hysterical what the Republicans are doing in order to get this passed. And like I said, this is slowing down according to F.A. Hike, this is slowing down our pathway on the road to serfdom, but it's certainly not getting us off that pathway. Okay, we still will have single-payer healthcare, especially as soon as if this Medicare system really passes, we're going to have a hell of a lot more debt. That's not good, considering our dollar is almost worthless right now. So, yeah, the public option debt, not really, but I'd say people should really worry about this Medicare agreement that's included in this new option because it's very fucking dangerous.